Please note for the record that all commissioners are present, either in person or via Zoom. First order of business then is the approval of the minutes from October 20th, 2020. Do I have a motion?
I so move.
Okay, we have a motion, I assume, to approve. Do we have a
Madam Chair, I
second?
second that motion.
Okay, we have a motion and a second to approve the minutes of October 20th, 2020. All in favor signify by saying aye.
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 Opposed, motion carried. Item number 3 then is the approval of the order of the agenda. Is there anything that we would like added or change? Hearing none, may I have a motion to approve the order of the agenda?
Madam Chair, I would move approval.
Thank you, Ms. Peach. May I have a second? May I have a second?
Second it, Tom.
Thank you, Tom. All in favor signify by saying aye.
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 Opposed, motion carried to approve the order of the agenda. Next item is the approval of the consent agenda, and each of you have received copies of bills, employee status changes, overtime, and a bond for check reissuance. Is there anything that you would like pulled for further comment or review? Hearing none, may I have a motion to approve the consent agenda as presented?
Motion approval, Tom.
Thank you, Tom. Second?
Second, Bob.
Okay, we have a motion and a second to approve the agenda, or the consent agenda, I'm sorry. All in favor signify by saying aye.
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 Opposed, motion carried. Next item is public hearing, and I'll open the floor for public hearing as it relates to MIDA bonds for Spectra Health Project. In this public hearing, let me see, I'm sorry. The
Madam
purpose,
Chair,
yes, sir.
Madam Chair, this is Jim Stewart. I'm an attorney with Arnson, Stewart and Wagner in Fargo.
Yes, sir.
We're representing Spectra Health as bond counsel. They're requesting Grand Forks County to issue bonds under the Municipal Industrial Development Act to finance the acquisition of a clinic and office facility. This is an existing building that's located in the 4th Street, 212 South 4th Street. It's the old hospital facility. The maximum amount of bonds is $2,750,000. They'll actually be issuing less than that. At the conclusion of the public hearing, we do have a resolution for your consideration that would authorize the issuance of the bonds. Bonds are being purchased by First International Bank and Trust in Grand Forks. As with all bonds issued under the Municipal Industrial Development Act, the county has no liability for any payments on the bonds. If you have any questions regarding the bonds, I'd be happy to answer them.
Okay, commissioners, do you have any questions of Mr. Stewart?
Madam Chair, this is Dave. We've done a number of bonds like this in the past where we are just simply a pass-through organization and we have no liability at all, as you just said. So I don't have any questions of him. I move approval of the request.
Okay, so we have a motion to approve the request. Do I have a second?
Chair, I second.
Okay, we have a motion and a second. Any further discussion or questions, comments? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried.
Madam Chair, I just have one quick
Okay,
question.
Mr. Ford has a question.
Mr. Stewart, just for the record, which law firm were you representing, sir?
Arnson, Stewart and Wagner.
Thank you.
Okay, and I'm sorry, Mr. Stewart, what was the second piece of it that you had indicated?
It was just the approval of the resolution.
Okay, and so that
During the
would
hearing,
be,
so.
all right, and that would be with chair's signature, and I'm not sure if Ms. Nelson needs to sign on that as well. I think on some of the documents she does. So may I have a motion to approve the bond resolution with chair's signature?
Madam Chair, I move for approval.
Thank you. Do I have a second?
Second, Tom.
Thank you, Tom. Any further discussion or comments? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried. So we will, sir, Mr. Stewart, get that signed and out to you possibly tomorrow.
Thank you very much.
Thank you, appreciate it. Next order of business is public health. Ms. Swanson, are you with us today?
Good evening, Madam Chair. Yes, I am here. This is Debbie Swanson from Grand Forks Public Health Department. And with me this evening is Michael Dulitz, also from Grand Forks Public Health Department. And Michael does have a presentation on data relative to COVID-19. Commissioners, we would like to present this information to you as your COVID update for this week. And then when Michael is finished, I have a little bit of additional information relative to vaccines and when we will begin seeing vaccines for COVID-19 and our planning efforts that will follow that. And then we'll take any questions that you have. So I'm not sure if Michael will be sharing his screen into the Zoom meeting or if you are doing that, Tom, whichever works best.
No, Michael will have to do it. I don't have a copy of it, Debbie.
Okay.
Okay. And can I just, I'm sorry, ask if each of you that are on Zoom, if you could speak up just a little bit, would really be appreciated.
Will do.
Okay, so anytime Michael is ready, we are.
You see my slides now?
Yes.
Perfect. Madam Chair and members of the commission, my name is Michael Dulitz. In normal times, I'm the Opioid Response Project Coordinator, and I'm pinch-hitting right now in the role of data and analytics leader for our COVID-19 response. I'm going to provide a little bit of an update related to our data in Grand Forks County. And this is meant to supplement as well the daily dashboard email that you should all be receiving. Looking at our dashboard for today, unfortunately, we continue to trend in the wrong direction. Our new cases per 100,000 did go over 200 per 100,000 for a 7-day average. Grand Forks has a population of about 70,000 people, so we are averaging somewhere in the realm of 140 new cases per day over the past week. A shining spot in what we're seeing right now is the increases that we've been having in testing. Our testing numbers have increased to over 11,000 tests per 100,000, so that's over 7,000 tests per week for Grand Forks County. And I think that is related to a variety of factors, new industries coming in and offering testing, the number of people who have never been tested before experiencing symptoms and going and get testing, as well as increases in serial testing in the long-term care facilities and hospital facilities, matching with their with the state's vulnerable population protection guidelines. Another spot where we've had a lot of change has been in the percent positivity category. We're above 10%. That does put us in the red, which we did hit that unfortunate milestone about a week and a half ago. And then our percent change in COVID cases is back up on the increase, and we are seeing greater constraints on hospital capacity at Altru. They have recently had to add in another inpatient unit, and they have our inpatient COVID unit, and they have approximately 31 individuals who are COVID positive at the hospital as of today. Approximately 15 of those are from Grand Forks County itself. The other are from either East Grand Forks, Minnesota, or outlying areas, that were referred in. Looking at a little bit of a snapshot, I think the last time I was here and presented to the commission was the 6th of October, so early October. So just to get an idea on where we're at, looking from early October to now, we've had a very significant increase in our new case rate, to the realm of 4 times the case rate for Grand Forks County. With that, we have had almost a doubling in the amount of testing that we have been doing, which is a positive sign that at least our testing capacity can keep up with the case rate. And then we've also been seeing an increase in our percent positivity. So even though we've been adding more tests, we've been seeing more of those tests come back positive. And then the other unfortunate increase has been in hospital capacity, where we have moved from the yellow to the orange. Early in the month, a lot of what Altru was seeing for their constraint was a large number of medical patients, so individuals with medical issues not related to COVID that were being admitted. Now we're seeing still a lot of medical need, as well as having COVID kind of layered on top of it, which has definitely provided a constraint to Altru. Looking at a comparison of Grand Forks to other counties in North Dakota, so the 4 large counties that I would consider to be our peer counties. Looking at Grand Forks itself, it's been kind of a constant battle for me to adjust the case rate up and up and up on the on these graphs when I create them every day. Unfortunately, I had to change it again for today, not so much because of Grand Forks County, but because of other counties as well. So, if you look at, as a basis for comparison, looking at what happened in August, when I was putting that on, some graphs, I wasn't even including it because it was such a peak, and now it looks small compared to where we're at right now. Comparing Grand Forks to our peer counties, Ward County has been, has kind of catapulted into the top spot in the state, unfortunately, with the number of positives that they've had. Going with the number of positives that Ward County has had, they've also had a significant challenge with getting people tested. I don't know if it's just poor uptake by individuals or poor willingness by individuals to get tested, but they're seeing testing positivity rates at almost 25% right now. The Bismarck, the Bismarck, Burley, Morton County areas have had, kind of sustained increase, and that sustained increase is continuing to occur. Unfortunately, both Ward County and Grand Forks County have now surpassed both Burley, Morton, and Cass County in the number of new cases that we are seeing per 100,000. And then finally, adding in the state, we are significantly higher than the state as well. Looking at a breakdown of our COVID cases by age group, the biggest age groups where we've been seeing increases in are the 30 to 59 age group, as well as the 20 to 29 age group. So a lot of individuals in that in those working age groups. The 30 to 59 age group, the rate per 10,000 is now exceeding the peak that we saw with the outbreak in August related to the start of UND classes. So again, these are sustained increases in case rate in the county. Two particular areas that I've been keeping a close eye on are the 0 to 19 age group, as well as the 60 plus age group. Traditionally, those have not had much impact compared to the working age individuals, and think that lack of increase has one, helped keep the number of deaths in the community down, and 2, helped us open our schools up. Unfortunately, we are seeing sustained increases that are kind of following the same trend as other age groups in both the 60 plus age group, as well as the 0 to 19 age group. Breaking that down a little bit more in that 60+ age group, we realize there's a lot of difference between being 61 years old or 67 years old and being 87 years old. So we wanted to see what was happening with the trends in those groups. So the 60 to 69 age group has been following very closely with what's happening in the community, and in some circumstances even exceeding case rates for other age groups. Followed by the 70 to 79 age group, which again is seeing a similar trend right now, whereas before, particularly before July, they were at a low incidence rate in the community. And then looking at the 80+ age group, before we saw a lot of what looked like to be just small outbreaks. So individuals in that 80+ age group in nursing homes were spread, it just happened in a very isolated manner, which was able to be addressed. Unfortunately, right now we're seeing individuals in that 80+ age group kind of following the same trajectory as what the community is seeing right now with the spread. The bad part is individuals in the 80+ age group that get COVID, 15% of those individuals will end up dying from COVID. That's based off of data that we've been seeing in North Dakota itself. So we do run up the risk of having a significant increase in the number of deaths in the community with this spread into the 80+ age group. We are now on day 218 since the first COVID-19 case has hit or was identified, I guess, in Grand Forks County. This is incidence curve, so this is basically an addition of every single case that we've seen in the county listed by day. One thing that they do talk about a lot in the epidemiology world when we're looking at pandemics is looking at the doubling time of cases. So how long does it take for cases to double or the total incidence to double in size? And that gives you an idea on the on the amount of spread that's happening. If it's a longer amount of time, that's better because that means that the spread is happening a lot slower. The dots in green on here are the actual doubling times that we have seen over the course of COVID being in Grand Forks County. So the doubling times after April 15th, because otherwise we'd have a lot of really small dots in there. So we did do a really good job over the summer at preventing large increases in the number of cases. Unfortunately, the dots are getting kind of closer together in an unfortunate way because each time we see that double, that is a lot more cases than the previous doubling. So when you look at the doubling that happened in September versus the doubling that happened recently, that's an addition of over 2,000 cases into the community. We can also look at an estimated doubling time as another way of kind of getting an idea of where we're at with the spread that's happening in the community. So the doubling time gives an idea based off of the past 14 days. If we continue this trend past that 14 days, how long it would take for us to double the number of cases that we're at that point. So again, a lower number or a higher number is better. We want to increase that doubling time in between when those cases double. So looking at the results for the first, that was 23 days. For today, that was 24 days. So based off of that 23-day time frame, if our doubling time, if we continue to increase at the same rate that we are right now, we would be looking at doubling our cases on 11/25 this month. So we'd move from about 4,700 to 9,000 total cases in Grand Forks County since the start of the pandemic by essentially Thanksgiving. If we continue on again past that, we would double again, just before Christmas. And then if we move on past that, just after New Year's, we double again, and we'd be at almost 38,000 cases in Grand Forks County, or over half of the population, unfortunately. So again, bringing this doubling time up by bringing case rates down is very important for the community. Otherwise, we will continue to see this exponential increase in the number of cases that we're seeing in the community. Unfortunately, with an increase in the number of cases, particularly with the increases in the 80+ age group, we're also going to see an increase in mortality. We've been fortunate in Grand Forks so far in that our mortality has been relatively low compared to both what we've seen statewide as well as what's been cited as kind of the case fatality rate in journals throughout the country. So right now we're at about 0.46 case fatality rate. So 0.46% of individuals who get COVID ultimately end up passing away from COVID. If we look at the increase that we'd see in cases, we'd be expecting, if nothing changed and we kept this same growth rate, we'd be looking at about 154 deaths by the 10th of January. If we followed a trajectory similar to what we've seen in the state, which could be possible given the increases in the number of nursing home or cases in the 80+ age group where the mortality is higher, we'd be looking at 402 cases by the 10th of January. Again, this is a lot of this is based off of a fair amount of assumptions, but the underlying kind of take-home point that I want you to have is that what we are seeing is not linear growth. It's not something that's going to keep happening slowly. It's going to keep happening exponentially if we keep having the spread happen unabated. So don't think of it as a linear growth. If we're looking at the number of cases, think about what would happen and the potential impacts based off of exponential growth. Looking at our positivity rates, again, for Grand Forks, we are seeing over 10% positivity right now. When we compare that to our peer communities, we are matching pretty close to what's happening in Cass County as well as Burley-Morton. Ward County, again, as I mentioned earlier, has had a lot of issues right now with getting testing uptake, so getting people to take tests, as well as they have a low amount of serial testing that seems to be happening. What that means for them is that they're having a lot more individuals who are symptomatic and have a high probability of testing positive, being the ones that are going to get tests because they aren't testing a lot of people. And so they are at, I believe it's 24.7% for their percent positivity, their 7-day percent positivity that was reported out today. We're fortunate in Grand Forks that one, we've been able to increase our testing, the amount of testing we have in the community. And two, we've also been had relatively good community participation in testing, including serial testing. We do have a lot of serial testing availability in that we have college students that can get tested frequently. We have community testing events, as well as we have a fair amount of long-term care facilities, hospital facilities, group home facilities where we do have frequent testing happening in those settings. And then compared to the state, we are kind of following along with the general increase in percent positivity that the state is seeing. Breaking that percent positivity for Grand Forks County down, looking at what we're seeing as positives based off of serial testing, so people who have been tested before, versus unique testing, individuals who had never been tested for COVID-19 before. Right now we're seeing a pretty steep increase in the number of individuals who are being tested for the first time testing positive. That rate is now over 25% for Grand Forks County. Whereas we're seeing a smaller increase in the the number of positivity or the percent positivity in the individuals who are being serially tested or they've been tested before. One anecdote related to this, the Valley Senior Living, they have been testing their employees frequently related to kind of the CMS guidelines for how often they should be testing based off of the amount of COVID in their community. Right now they're seeing they were used to seeing about a 0.5% positivity rate when they've been doing their testing events. This last one, they were at 2.9% positivity, in this group of individuals who are being tested frequently. So that does also indicate a fair amount of community spread, even happening to individuals related to, or that are actively working with vulnerable populations. Again, taking a look at the breakdown in actual testing numbers, we have had an increase in the number of serial tests that have been happening in the community. Again, I believe that is related to individuals being tested at UND, individuals in long-term care and hospital settings, taking up a lot of those serial tests, as part of their protection plans. And then we've also been seeing an increase in the number of unique tests as well. Looking at our hospitalization rate, I do believe that our hospitalization rate is still underreported for Grand Forks County. I am working with the state on determining how they are reporting that, working with our field epidemiologists as well. What we're seeing when we are working with Altru is that roughly half of the individuals in there are from Grand Forks County, so we're just trying to figure out what that disconnect is. So what was reported out by the state today is that we had 9 individuals from Grand Forks County who are actively hospitalized with COVID-19, which does put us at the lowest point in the state. Again, I have some questions about the reliability of the hospitalization data. I want to be able to clarify that a little bit more. But we are still seeing increases in the number of individuals who have been hospitalized with COVID-19. One final comment on that is that we are fortunate in that we're seeing less acuity in those individuals who have been hospitalized. So even though they are being hospitalized for a lesser amount of time, and so the disease course is a little less burdensome both on the hospital and on the individual due to improved therapies and better knowledge of how COVID-19 does impact the individual. And then one final slide, and this will be a good segue for Debbie's discussion on contact tracing capacity and vaccine discussion. This is a breakdown of the contact tracing by entity, the entity that's been conducting the contact tracing for Grand Forks County. So Grand Forks Public Health has been sticking around a third of the cases that we've been taking, but as we've been seeing increases in case counts, that has been increasing the burden on us as we've been taking on additional cases. In October, up to 877 cases. We have had a lot of help, and it was great help just in time for us in that the UND stood up a specific contact tracing team for individuals who are UND students, and so they've basically been taking all the cases in the 18 to 24 age group. And then we are still receiving a lot of assistance from statewide contact tracers themselves. So individuals either hired by the state or contracted with the state, such as students from UND working with the MPH program contact tracing. So UND has a separate program for on-campus students, as well as they're assisting with the statewide effort as well, with using MPH and other UND students to assist with contact tracing statewide. With that, I'll turn it over to Debbie, and then we can wait until the end for any questions.
Thank you, Michael.
Yes, thank you, Michael. I do have a few additional comments for the commission relative to some of our other endeavors that we are working on with our COVID-19 response. As Michael mentioned, contact tracing has been a very big part of what we've been doing. You can see that from the slides there, there's a tremendous amount of effort going into that work. The state, as you may know, changed some of their contact tracing protocols so that cases would be contacting their own close contacts. We felt fortunate that we didn't need to make that change initially, but with 218 cases arriving today, I know that we will be making some adjustments to our protocols as well, which is hard for us to do So all the more reason for us to double down on our prevention efforts and keep the case counts low so that we can keep up with it and do really high quality contact tracing, which we feel is very critical to this effort. I did want to give you a few updates on vaccinations. We met today with a few of our partners relative to vaccination efforts. The enrollment is available through the North Dakota Department of Health, and we have about 20 plus providers in the community of Grand Forks that have indicated an interest in having vaccine, either for initial vaccination at their healthcare organization or ongoing vaccination efforts once the initial vaccines are completed. And we have a good mix of pharmacies and healthcare organizations, Grand Forks Public Health, long-term care organizations, and even some private providers. So we feel good about the number of entities that will be able to receive vaccine, administer it, or in some cases store it for us at ultra cold chain temperatures. But it's going to require a tremendous amount of coordination, as you can imagine. We typically plan for large-scale vaccination efforts in pandemic flu, where we get a large volume of vaccine all at one time, and we open it up to priority groups followed by the general public. But this will be a much more complicated dance, so to speak, where we will be doing those priority groups first and making sure that the vaccine gets shipped directly to those places first. There are 9 vaccines in development in the United States. Some have advanced to the late stage clinical trials and in fact have completed a lot of their enrollment of patients. And those include the companies of Moderna, Pfizer, AstraZeneca, and Johnson & Johnson. Those that did pause their clinical trials for a short period of time to explore some unfortunate events that happened have resumed their clinical trials, and we are now anticipating that we should have some vaccines before the end of the year. The FDA has required that the companies have a solid, good 2 months of data to show safety and efficacy before they release them to the market. We've been told to be ready by November 15th, but I believe that is coming from the federal government that wants us to just make sure we have our solid planning in place by November 15th. I would be very surprised if we have vaccine by then. As I mentioned, there's going to be priority groups, and they will start with healthcare workers, including the healthcare workers that work in long-term care and their staff and residents, and then critical infrastructure personnel and persons at risk for COVID complications. So those will be among the first tiers, and we will prioritize within those groups as well. As mentioned too, the vaccines may require some strict, what we call cold chain storage requirements, meaning ultra cold temperatures for which we do not have storage, but the University of North Dakota does, and Altru is also in the process of purchasing some of that as well. The good news is that some vaccines can be refrigerated after they're removed from that cold chain storage and then administered within a period of time. It could be from days to up to 15 days. So that will help us to give us a little bit of a cushion to make sure that once we receive vaccine, we get it all administered in a timely manner. It will be important that we have a good uptake, and we'll be working on a lot of communication messages, but we also know that physicians in our community will really want to examine the data before they start allowing it to be administered in their institutions, to their healthcare providers, and ultimately to their patients. So that will be something that we'll be working through as well. So there's a little bit of an update on vaccines. It's good news, but it's still on the horizon and something that we'll just have to constantly be prepared for. A couple of other things I wanted the Commission to be aware of that are not vaccine related, but still COVID related, are that there will be some new zip code data that should be coming out. It will allow you to see the presence of active cases within certain zip codes within the county. I've been working with the League of Cities on this, and the State Health Department is just beginning to release that. So as soon as we have some information to share, we will be able to do that. Dr. Walls, your health officer, sent letters to the mayors in Grand Forks County. So combined with that zip code data and his letter and the county dashboard, we hope that it leads those mayors and city councils within all the communities to begin thinking about what they can do from a policy perspective within their communities. And then lastly, probably most disappointingly, is that we've had a lot of challenges recruiting public health nurse positions. So that means we still haven't yet filled our 2 school nurse positions, nor our nurse position for the Grand Forks County Correctional Center. We're continuing to recruit in creative ways and fill in, backfill with some of our staff as best we can. We had really hoped to be a little bit more successful and have those positions in place by now, but we're working against a lot of other factors with full hospitals and people out on quarantine and isolation because of either being exposed themselves or being in close contact. So it's just been a really challenging time to be recruiting for nurses, and salaries are becoming a little bit more competitive as well. So that concludes my comments unless there are any questions from the commission.
Commissioners, do you have any questions of Michael or Debbie? No questions? I have some if no one else does, or at least statements or comments. But anyhow, I just read where Dr. Birx and Dr. Fauci both are stating that we're entering into the most deadly phase of the pandemic. Do you support that thinking?
Yes, I do, Madam Chair. I think we are seeing increased cases, and I think along those lines follows increased hospitalizations, and then following that is deaths. That's what we've seen in the other communities in North Dakota. Might be different trajectories, and we may have a slightly different landscape here relative to our uptake of mask wearing and other prevention measures. But I do believe that as we move activities indoors and we start to see the beginning of flu season and people congregating more, I think we are headed into a potentially very dangerous situation, yes.
Okay. And then,
Madam Chair?
yes.
This is Dave.
Yes,
Will you
David.
finish, or I've got questions regarding the Michael's slides. It looked like Grand Forks County was clearly in the red zone. Is that accurate, or is that just a statewide red? You're muted, Michael. There you go.
Commission Member Engen, based off of the health officer's dashboard, we are firmly in the red category in that respect. When we look at the governor's dashboard, unfortunately, there is a level of kind of judgment call in the case of both the North Dakota Department of Health as well as the governor's office on determining how counties move based off of their dashboard. That is kind of one of the weaknesses of their dashboard and one of the reasons that kind of prompted us to to continue putting out our dashboard when they put this out. So the big thing that I have seen on the governor's dashboard side is that when percent positivity goes over 15%, then they start talking about moving a county into red on there. So I would anticipate Minot and Ward County to definitely be moving up to red, if not this week, then next week. For Grand Forks, I do feel like the health officer's dashboard is a good reflection on where we're at. The intention, was to have a level that would call for action, and that was the red level. The orange was certainly, the yellow and orange are certainly supposed to be the warning levels, but now, we're firmly in red on there. And I'm not sure when that's going to change with the, capacity constraints that Altru's been experiencing.
But the follow-up to that, I'm much in favor of sports and all kinds of activities in schools, but it seems to me that the schools in the state and in this county in particular are acting as if there is no issue. What what is the Department of Health telling the schools about what they should be doing, especially with athletics? We've got a couple of teams here in the Northwood School that had to be quarantined because somebody tested positive. And we've got teachers who have it and students who have it and so on. Yet, I don't know what guidance they're getting on how they should be doing their school. Can you, either of you answer that, Debbie or Michael?
Well, I can start, Commissioner Ingham, and then I'll let Michael finish up because we both have different roles here in how we receive that information. Michael's closer to the contact tracing than I am. What I can tell you is decisions on sports are made by the North Dakota High School Activities Association. And they did come out last week with a statement about, and I believe the governor repeated this, that the transmission appears to be within teams and not between teams. And that may be true, but there is significant transmission within teams. And you're right, it does take them out of quarantine. Local health departments have repeatedly asked for the High School Activities Association to put a pause on sports because we do feel that it happens at the detriment to the educational goals of each school. And so when you take a team out and then they're out of school, they're in distance learning and lots of decisions need to be made. But it appears that those decisions about continuing those continue to be in the hands of the High School Activities Association, and all the schools belong to that association and have to abide by a lot of the decision making there. So it's a tricky one, to say the least. I'll stop there and I'll let Michael add in anything else that he is aware of that I might have forgotten or from the contact tracing perspective.
So just to build off of what Debbie had mentioned, one example of where the health officer's dashboard has been used to inform policy is Grand Forks Public Schools does have a spectator policy that's directly tied to the health officer dashboard. So the number of spectators that are allowed at an event is directly related to what level we're at on the dashboard. Right now we're in red, and so spectators are prohibited at at sporting events that Grand Forks County or like the Grand Forks Public Schools would put on. When we were at orange, there was a limit on the number of participants, and then that limit would change, or it would essentially double if we were at yellow. So that is one example of where the health officer dashboard is very useful to a school district, because then they can blame it on the dashboard and ergo blame it on the numbers, rather than saying it was something that was arbitrarily put together based off of a judgment call based on the numbers. This way it kind of levels the playing field a little bit, and kind of provides an opportunity for us to say this is what level we're making this decision at. I do also know from attending and presenting on data at at the Grand Forks Public School meeting. One of the priorities that they have, it's kind of tiered priorities that they have. They view they view the school as kind of being an important part of the community and an important source of community pride, and that individuals want to go to athletic events and things like that. They also view school, extracurricular activities in school, such as sports, to also be a good character building activity for students. But then ultimately their core goal is to educate students. And when we're looking at a pandemic, you have to kind of back up to what's the core goal that you want to have for the community when we're trying to also manage a pandemic at the same time. So in this circumstance, it does make sense before potentially closing a school, moving to distance education, to kind of take those those actions first based off of what you're seeing, or what kind of the health officer dashboard is providing to you.
One more follow-up there. Does each school district do it the way they want? I mean, they each have their own choice? You're talking about Grand Forks Public School District, which is the biggest, of course. How about all the small districts?
I am aware that Larimore follows our dashboard very closely. Superintendent Swantek is the is the superintendent of schools for the county, so that might be an opportunity, if you're looking for additional input for the commission in that role, he may be able to provide some insight as well. I have talked to him on a few occasions related to it. I do know that Larimore has moved a fair amount of their education online because of the number of cases that they're seeing.
Any other comments, commissioners? Debbie, go ahead.
I can add one other comment to what Michael said, and that's a workforce issue, because we do have points of contact within the schools that they can reach out to our public health staff, and we have 2 nurses that are spending a lot of time on schools in Grand Forks County. Where they spend a significant amount of their time is on sports, helping administrators make decisions, helping coaches with quarantining teams. That's where they spend a lot of their time. So that's probably where school nurses would spend their time as well when they're assigned, and those that are working in Thompson and Northwood.
Can I just make a comment on that with respect to children? I just read another article by Dr. Brooks, who said that 853,000 children in the U.S. have tested positive since the onset of the pandemic. 200,000 new child COVID cases were reported just from October 1st through October 29th, and 61,000 new child COVID cases reported just this past week across the U.S., which is the highest number of COVID positive children since the pandemic began. And so I don't know if that coincides with the information that you have, but I truly appreciate and support that our local school systems are taking all the necessary and needed precautions requiring face masks and things like that while children are in school. However, just an observation that I see is that once they're out of school and they're back in their neighborhoods playing with their friends and neighbors and whoever, that there aren't a large number of children that are wearing masks. And so that concerns me. And if they're not using face masks outside the school system, it seems almost counterproductive if they're not wearing the masks outside of that school setting, while they're associating with their friends. And so how do we get that message out to parents and their children?
Madam Chair, I can comment on that. So, yeah, there is a joint information. I don't know if center is the correct word, the JIC, and it's made up of all of our institutional partners, and it's those of us that are responsible for messaging, pushing messaging out. This could be a good topic or a good subject that I can bring up at the next JIC meeting, Debbie, something we can discuss. And I think that would be the appropriate place to start that discussion then. And then why that is appropriate is you have the public affairs people from all through UND, the city, the county, the school district, the air base, all basically rowing in the same direction on messaging. So I'll take that to the next meeting and see what we can do.
Thank you. Any other questions or comments from the commission?
Madam Chair, this is Tom. I've got a question. It's probably Michael, but and my math skills are maybe a little limited, but I'm looking at your graph and it's showing that there are 38,000 projected cases in January if this continues to grow. Is that true?
If we continue with if we continue with this doubling of cases that we're seeing and the frequency of the doubling, that's what we could end up foreseeing as the case count by the by January.
Well, and that's what I thought. And to me, that's maybe the most concerning fact that I've heard this afternoon, because, and even the cases in December are going to be overwhelming, but if this would continue, pretty clearly all true hospital is going to be overwhelmed, and the care of patients is going to become very difficult, even patients that aren't COVID related, if you have this many sick individuals that are trying to be hospitalized. Is that a fair assumption?
Yeah, I think that would be a fair assumption, that if we increase the incidence in the community, particularly active at a particular time, that will end up, even with improving therapeutics and decreasing death rates, that will still have a large impact on all true. They only have about 195 beds on that they can staff right now, and so they would be looking at changing their standard of care, and things of that nature. I do want to add the caveat that is that is based off of things not changing. Things could change both because of our actions, or they could change. They could just kind of follow a natural progression and decrease. But if we do continue at this pace, this is what we're looking at.
And I agree, there are a lot of variables, but unless our population decides to make some changes, I don't know that the virus is going to change on its own. It might, it's unpredictable, but unless we make some changes, we're going to continue to at least go up in case numbers. And, if we're at 38,000 in January, which I would hope that would be just terrible, but if that would be the case, if you project in, we had 15 in the hospital right now, 9 times more would be 135. There's no way that all two could handle that type of a caseload.
And that could be a fair, a fair presumption.
Madam Chair, this is Dave again.
Yes,
Follow
David.
up on that. Michael, I wasn't sure when I was writing down those numbers. That's 38,000 or whatever it is. That's Grand Forks County? If we don't
Grand
do
Forks
that,
County,
Grand Forks County.
Yeah.
How big is Grand Forks County? Anybody remember?
70,400.
That's kind of astounding. If that doesn't get people's attention, I don't know what would. What?
That's what happens when you have exponential growth versus linear growth. It's kind of hard. I have to remind myself a lot of it too, but it's kind of hard to think about it in that respect. Just because that's how quickly it grows when that's what your curve looks like.
Quick comment, do we as a commission have any authority like the mayor has? I applaud the mayor for the mask mandate in Grand Forks and the other mayors. We don't have any authority like that throughout the main county, I suppose, do we? Anybody?
Commissioner Engen, members of the commission, I have researched quite a bit about the authority of the Board of Commissioners in relation to a mask mandate or other authority in this regard. I have also spoken with Aaron Burst from the North Dakota Association of Counties, as well as other state's attorneys throughout the state. It's my legal opinion that because we're not a home rule county, the Board of Commissioners does not have ordinance authority to issue a mask mandate with enforceability provisions or other like ordinances. The Board of Commissioners could pass a resolution recommending the wearing of masks in the county or other provisions, but it would merely be an advisory or a recommendation. Alternatively, the local health officer does have the legal authority to issue any order that may mitigate the spread of a contagious disease, and that would contain enforceability provisions. The Board of Commissioners could pass a resolution recommending action by the local health officer. However, that any orders he may issue would be within his discretion.
Thank you, that answers that.
Madam Chair,
Yes, Cynthia,
I do have a question of Debbie Swanson.
go ahead.
Debbie, I know that the mayor has put a mandate out to wear a mask. Of course, there are no repercussions if you do not wear a mask. And I know that we've got some people that were picked in City Hall recently Are we seeing, or are you seeing in the city of Grand Forks an uptick of individuals wearing masks, or hasn't it really made a difference?
Members of the commission, Commissioner Keach, I do believe it has made a difference. I think there were some efforts that were happening prior to that mask resolution being passed by the Grand Forks City Council that I think set the stage for it. And that was a lot of large retailers that issued those requirements for their businesses. The University of North Dakota, Altru, the county, for county buildings. I think those things all really set the stage for it. We are noticing, I think anecdotally, a lot of increase. And when Hugo's did their requirement, there was a group of students that studied it in the days prior to and up until the time it was implemented in Hugo's stores. They did observational studies in their parking lots, and it significantly increased the usage of masks, people going in and out of the store. So policy really does work. So it sends a really strong message and encourages people to act in a way that you are asking them to. It's the same as things like smoke-free laws and texting and driving and other kinds of things. So I believe there's great value in policy and changing behavior. We've seen it on a number of public health and public safety endeavors.
Thank you very much for that information.
So Ms.
I certainly would like to see the health officer maybe carry that mandate throughout the county just to see if we could see these numbers drop, because they're so high, and it's scary when, we look at the long-term data of what could happen when more people do get closed in. We've been fortunate with warmer weather now the past couple of days, but by the beginning of next week, there's going to be a lot more people inside than now.
So Ms. Wanstead, just so, did I get this correct? So if the public health officer or the medical director, Dr. Rose, if he mandated face masks countywide, does that pull the city into that as well?
Madam Chairman of the Commission, since he is the county health officer, I believe any orders he would issue would apply equally throughout the county, within the city, or in the rural parts of the county.
Okay, and if he issued a mandate, that mandate could carry with it then the effects of law, could it not, and have enforceability tied to that?
Madam Chair, members of the Commission, yes, I believe it would be any violation of local health officer's order is a Class B misdemeanor.
So we do have there is an option if we went through.
Same as a DUI.
Ms. Swanson, what are your thoughts on that? I know that's a bad thing to ask you. I'm not going to ask you that one. I take it back. So I don't know, commissioners, would it be, do you have an appetite for talking to Dr. Waltz about this further? I'm not sure it's going to go anywhere beyond what it is right now with some further restrictions, but I think until we have enforceability, it's not going to. Our numbers are such that, to me, they're alarming. And if we are just now heading into, the most deadly phase and looking at the projected numbers that are possible, I mean, who would have thought we were going to be at this level? I didn't think so. I mean, months back. And we're moving into the most deadly phase of the pandemic and all the unknowns that come with that. Would you, again, have an appetite to visit with with Dr. Waltz on that.
Madam Chair, this is Commissioner Ross. I think that's a decision that the doctor needs to make. I think the thing to consider is, okay, it's a B misdemeanor, enforceable, but the police and sheriffs are busy enough.
Okay, but I hear what you're saying, and that's kind of been part of the conversation all the time, that law enforcement doesn't have staff to do this.
No, they don't.
But I also think that as leaders in our community, we have to find a way to make that happen.
As I said, that
can
would
be accomplished, and I don't know how that is or what that would look like, but I think that it warrants having a discussion with Dr. Waltz. It's his ultimate decision. on
Correct.
What he wants
Absolutely.
to do, not ours.
Yep.
We're just having a conversation is all.
Right.
So we know what options there are, or if there are options. And if there are options, then how are we going to accomplish that? I'm not one that says we can't do that, or, that's not going to work or whatever. Let's make it work. We can. But again, we need to have, if the commission is, like I say, has an appetite for talking to Dr. Waltz, that's entirely up to the group.
Madam Chair, this is Tom. I would suggest that we invite Dr. Waltz to our next commission meeting. Hopefully that isn't too late, but I think we should hear from him.
Could we do a special meeting prior to that? I mean, we're 2 weeks out. And just in this last week, our numbers, Grand Forks County had 850 new positive cases identified in just the past 6 days. The state of North Dakota had 6,852 new positive cases alone in the past 6 days. And there were 69 deaths in the state in the past 6 days. So I think if we're going to do that and have that conversation, it should be a top priority and as soon as possible. Yes, Andy?
Madam Chair, members of the commission, just a couple comments on that. If that is a conversation that you would like to pursue forward, just keep in mind, like any order by the health officer is a B misdemeanor, which is the same level offense, arrestable offenses like a DUI, simple assault, etc. That being said, I think they would be privy to the commission to have more people than the doctor in that conversation. Those people should include the correctional center, the state's attorney, and most likely Northeast Judicial District Court, along with the sheriff's office and the police departments. All 5 of those spectrums are going to be substantially overwhelmed by a public health officer's decision to make this an arrestable offense. So if that is a conversation you have, I would highly suggest bringing all of them into the discussion or to be at the table.
All right, thank you
Yep.
for your comment.
Madam
Chairman,
Chairman, my advice to the commission would be to hold a special meeting with the doctor and then invite those entities that the sheriff mentioned so that you can dedicate a good block of time to just that discussion.
Absolutely. Well, and because you're going to have the discussion with all of those individuals involved, so you might as well do it up front. And so everything's on the table and we know what we're dealing with. Did one of the commissioners, did you say my name?
Yes, this is Tom. And I agree with Sheriff Schneider, and those are difficult problems to address, but I think we have to remember the most compelling number are this doubling of cases that we're seeing. And, we right now, our death rate is relatively low, but if it continues, it's going to grow pretty substantially. And there are people who may die from this that normally wouldn't have, just because they're not going to be able to get the type of medical care that they would now. And that's going to happen if we have cases like the health department is saying are possible. Now that it may not ever happen, and hopefully that's true. but I think we have to be prepared for it, or at least start talking about how we're going to address it. Thank you.
I just want to make a comment. My neighbors tested positive for COVID. And so, you know, they've had all the symptoms, the high fever, everything that goes with that. And the female has been having fevers like 101, 102, whatever. They spiked to 103.5 or whatever. And so took her into emergency. They waited in the parking lot, in the emergency parking lot at the hospital. And I'm not saying this is a negative about the hospital because I'm assuming that they were busy. But they sat in the parking lot for 5 hours waiting for them to see her. Nobody should have to go through that. And that's what's happening to our medical people. You know, they're doing as much as they can do. And we need to create an environment for them so that they can do their jobs. So what are the wishes of the commission?
Madam Chair, I would suggest that we set a special meeting for next Tuesday and invite Dr. Walls to attend, or maybe contact him and find out what day he would be available, and we'll have to work around his schedule.
Are the other commissioners in agreement with that?
Madam Chair,
Yes, ma'am.
as a member of the health board for Grand Forks, I would be more than happy to contact Dr. Waltz about potential meeting. I don't think it's a bad conversation to have.
Well, somebody needs to have it, I think. We need to do something, you know, and what's happening or what, you know, is happening now isn't working. And we have not, the future doesn't look bright. And so I think we need to. So are all the commissioners, you're fine with that if Ms. Peach reaches out to Dr. Walls and tries to set up a time where we can all get together and have that conversation?
I agree.
Sorry, go ahead, David.
I just said I agree with that.
Haley, I have a
Great, Tom.
Thank you. I have a question, you know, with the, you were talking about the, with the mandate comes what is that, a misdemeanor?
Be misdemeanor.
Of what?
Madam
Be
Chair,
misdemeanor.
So
yes,
Go ahead.
a violation of a local health officer's order is a Class B misdemeanor.
Can they make it something less than that, like just a fine?
A Class B misdemeanor outlines the highest possible penalty that could be imposed. There's no obligation that the highest possible penalty be imposed. It still, if somebody's prosecuted and convicted, it still could appear as a B misdemeanor on their record, even though it could be only a fine is imposed as the sentence. Alternatively, there are other options, such as a deferred imposition of sentence, a deferred prosecution. And so all of that is in the prosecutor and the law enforcement officer's discretion.
And also, I mean, I don't even know if this, I'm just throwing this out there. I mean, we have a number of retired judges. I mean, could we hire them for the interim to deal with
I
these
think
cases?
that's premature.
I'm just throwing it out there just for the sake of discussion. Something to think about.
Yeah, I don't think that's a solution.
Okay, that's fine. Just a thought. Okay, so Ms. Peach, if you would go ahead and reach out then to Dr. Walls and then see if he has a couple of days there, so we have some options, and then send that out to the commission and we'll schedule a time for us to get together and reach out to all the individuals that need to be participating.
And then, Madam Chair, I'll also keep that information. I'll work with Ms. Ms. Swanson on that as well.
Absolutely. Thank you, I appreciate that. So, Public Health, Debbie and Michael, do you have any other comments, information to share, things you want to add?
Madam Chair, I don't have anything else. Thank you for your attention to our update.
Thank you for your update, and again, thank you and your staff for everything that you do. We so very much appreciate it.
Thank you.
Okay, then the next order of business is a city township hearing on minimum sale price. And did you want to speak to that, Mr. Ford?
Madam Chair, I certainly can. Ms. Nelson asked that I read this memo to the board. Dear board members, according to North Dakota Century Code 57-28-11, the hearing for the objections to the minimum sales price determined by the county commissioners on the property acquired by tax deed is set for Tuesday, November 3rd, 2020 at 4 p.m. in the county commissioner's room on the 6th floor of the county office building, 151 South 4th Street. Any member or representative of the governing body of any taxing district may appear at the hearing with reference to the fair market value of the appraised property, and the board may make appropriate changes in the minimum sales price of the property. A list of the property showing the minimum sales price follows. Asterisk marks property previously on sale. I recommend the board approve the prices and set the property sale for November 17, 2020 at 2 p.m. in the county commission room, county office building. Terms of sale are cash or check only, submitted by Debbie Nelson, Director of Finance and Tax.
Okay. Is there anyone on Zoom that would like to make comments or has concerns regarding the prices that have been established? Okay, hearing none. Commissioners, is there anyone that would like to make a motion with respect to Ms. Nelson's recommendation?
I would make a motion to approve the tax.
The prices
The
and
prices,
set
yeah.
the property sale for November 17th, is that
Correct.
at 2 o'clock? And that will be in this county building. We will make special arrangements if somebody, for those individuals that wish to attend. Okay, I have a motion to approve the recommendation. Do I have a second?
Madam Chair,
Yes, ma'am.
I'll second that motion.
Thank you, Ms. Peach. I have a motion and a second. Any further discussion or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carried. All right, next one is Safe Kids. Karma, are you still with us?
I sure am.
Thank you, good. I'm going to have you speak up, please.
Yes, I am, Madam Chair. I'm here.
All right, so what would you like to present today?
Yes, so thank you for allowing me to attend, Madam Chair and County Commissioners. As you know, my name is Karma Hansen, and I'm the coordinator with Safe Kids Grand Forks. I came before you in August to talk about a scenario which Safe Kids was looking to pursue funding for our operational costs. For a period of 5 years' time is what we're looking for right now. Our annual operating budget for Safe Kids Grand Forks is about $234,000. And we have a team of stakeholders who have been working with us diligently. We had a potential opportunity where we were challenged that a funder would assist with the fundraising efforts of community businesses and individuals for half of the funding needs for the year. If we could look to the city and the county and the state for grant funding or support for the other half of that. When I first approached the commission in August we talked about waiting for me to come back for the request based on what we found out from the grant that I had submitted to the North Dakota Department of Transportation, and a conversation that was happening with the city. Mayor Bochinsky is a member of our task force, and we then presented to the Grand Forks City Council. And so given that I have this number amount from the state and the grant offer that they are willing to provide and able to provide, and the information from the city, I reached out to Mr. Ford and to Ms. Haley, and we had a conversation about that last week, and talked about me coming back to the commission with the proposal. And Tom, did you want to talk about that, or do you want me to present the number that we talked about?
Ms. Hanson, if you sure can continue on, if you'd like, not a problem.
Okay, so the state of North Dakota was able, we're looking for grant funding support, or city, county, state funding in the amount of about $125,000 per year over a 5-year period of time. We were able to secure from the state their DOT budgets go from October 1 until September 30th, and I had submitted a request to the state in the amount of $52,000. They rated that based on the start date of January through September, and so provided me with $40,000 support from the state. The city council voted on providing $25,000 a year times 5 years, and that was approved at the city council meeting. And so when I talked with Ms. Blomstead and Mr. Ford, we had a discussion about approaching the county if the amount that Sheriff Schneider had thrown out last time, and which would be matching of what the city of Grand Forks has provided of $25,000 times a 5-year period of time, and whether that's certainly open for discussion, but that was a number that we wanted to throw out to the commissioners for consideration.
Thank you. Commissioners, comments, questions of Karma?
Madam Chair, Commissioner Falk, it's a wonderful project. I followed it for years, and it's a really worthwhile project. My concerns are, of course, are the financial part of it. First of all, I don't think we can commit to any more than 1 year by law for the project. But you know, the city has sales tax, which is a wonderful thing for them as far as creating extra dollars. We're limited on our budget to property tax, and our budget has already been set. So I have concerns that $25,000 is a reach right now. But I'll throw it out to the rest of the board to hear from them.
Commissioners?
Madam Chair,
Yes, Ms. Peach?
we wouldn't be touching the budget for 2021, but we would probably be looking at cash carry forward. I'm making an assumption that that information probably would need to come from Ms. Nelson. So is there any opportunity this could be tabled until the next meeting when she would be here?
Madam Chair, Commissioner Peach, I did visit with Ms. Nelson ahead of time, just basically ask her if that was the board's wishes to commit the $25,000, is it there? And it is. But again, it's the board's decision if you want to table it until she's back. But I did confirm with her that it is something this board could do, and it's available. It would just be an amendment to service agreements. So you can do cash carry forward. And Ms. Wamstad and I discussed this with Ms. Hanson as well, as when does she need the money. The county, again, if the board was to approve Ms. Hanson's request, you could bring it out of cash carry forward, and Ms. Hanson would basically put it in escrow, quote unquote, and wouldn't use it until 2021 or it could be amended to the service agreements contract for the following budget year.
Thank you, Mr. Ford.
Madam Chair, I agree on the carry cash or the cash forward is the only solution as far as paying it. I think as a commission, we also have to remember though that we can't keep doing that all the time. And we can't keep doing it next year and the year after. We have to find actually a revenue source for it. And so we need to be thinking about that.
Well, there's a lot of unknowns that are before us that we don't know. And what was my other thought on that one? I lost it.
Madam Chair,
Yes, sir.
I'm going to make a motion that we support it for $25,000 out of cash carry forward this year. But that we have to, that this isn't a commitment that that we can do it for 5 years. We'll do it and we'll see what can happen next year when we budget.
So would
Madam
we,
Chair, I would second that motion.
okay, we have a motion and a second. Any discussion, comments? So my question then is, would we have to have a service agreement signed for this year? And then we could do a new service agreement then for 2022.
Yes, Madam Chair, you're correct. So we can't go multiple years.
Right.
So as we do with all of our partners, our third-party partners and stakeholders, Ms. Hanson would get a letter from Finance and Tax, basically stating, what's your budget ask for 2022. So this is when we start preparing for our budget.
Right,
Yep.
right.
Yep, and as the budget committee usually does for our third-party partners like St. Kitts, they typically would be asked to come in and just do kind of a brief presentation. And then it is up to the budget committee or the administrative services committee to include whatever that ask is in the final budget that goes to the county commission. And Ms. Lomstadt and I were tasked with visiting with Ms. Hanson about, is this program appropriate to enter into a service agreement? And I think Ms. Lomstadt would agree that in visiting with Ms. Hanson is definitely appropriate. There are services there that it is appropriate. So that would be the board's option, is you could approve it out of cash carry forward, and then Ms. Hanson would submit another budget request for 2022 at probably about that April-May timeline.
Okay. All right.
Did I get that right, Ms. Lomstead?
Yes, you did, Mr. Ford. Thank you.
Karma, do you have any questions?
No, I don't at this time, Madam Chair. If you have any questions for me or anything additional, I'm happy to answer them.
No, I think everybody's pretty familiar with Safe Kids and all the great work that you guys do. So, and if not, go on their website and see. So, commissioners, so did we get a motion from Mr.
You have a motion and a second.
And a second, and so no further discussion. Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried. Thank you, Karma. And if you want to just reach out to Mr. Ford with respect to the service agreement, he'll help walk you through that and share the information that we need. All right?
Yeah, sounds good. And thank you so much. I appreciate the support of the Grand Forks County Commission. As you said, we would invite any of you at any time to come to any of our Safe Kids meetings or to any of our events. We do our meeting right now via Zoom. So it would be a really easy way for any of you to attend and see and learn a little bit more about the work that we do. Certainly things have changed because of COVID, where we're not doing some things, but we've also had an increase and an uptick in things. And, I will say we are picking up a lot of the work that the Grand Forks Public Health did, is they're not doing work in the arena of child passenger safety and things like that right now. There seems to be a lot of needs from Grand Forks County Social Services with clients right now, and we're very, very happy to help with those clients and those patients. And you can learn a lot about us on our website or Facebook page, but we'd also encourage if anybody wants to come to our meetings. Our next one will be on Thursday, December 10th at 12 noon. And if you're interested, just send me a message and I'll get you on our email list and would welcome you at any time. But thank you so much, commissioners, for your support.
Thank you, Karma. You take care and stay safe.
Yep.
Okay, so the next item then is the sheriff's office. Oh, she didn't talk about,
Oh, I'm still here.
yeah, the letter, Karma.
I apologize,
No.
Chairman Knopf. We did receive the grant, as I mentioned, from the state of North Dakota for work that we do in the upper northeast region of North Dakota. That needs to be signed off by myself as the program coordinator, by our Altru fiscal agent, which Christy Hall Duran has signed off on that. And then it also needs the signature of the chair of the county commission, just to indicate that we are a viable organization that is doing the work that is stated within the grant and within the service area that has been defined. And so I have reached out to Chairman Knopf asking about her signing that for us, and a copy of that was sent along to her and then subsequently to you as commissioners, just so that you were aware that that request has been made to sign off on that. No money will come to the county. That will come directly to Altru and to Save Kids. It's more just a matter of verifying that the work is being done.
Thank you. Any questions of Karma?
Madam Chair,
Yes, ma'am.
I would move approval for you to sign the letter so that the Safe Kids can get their funding.
Sounds good. Thank you. Do
I
have a
second it.
We have a motion and a second. Any other comments? Hearing none. All in favor signify by saying aye.
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 Opposed? Motion carried. We'll sign that and get that back to you, Karma.
Thank you again, Madam Chairperson. I appreciate your help, and again to the commission as well.
Thank you. You take care.
Yep. And thank you guys for all the work that you're doing right now during this really tough time.
Thank you.
Thank you.
Appreciate it. Okay, Sheriff's Office.
Good evening, Madam Chair, members of the commission. This is Sheriff Andy Schneider coming before you. I came a couple months ago requesting funds from sale of assets regarding old vehicles that we sold at auction to help in assistance of the purchase of a new fleet vehicle, police vehicle that was totaled
Anybody
out
else
in an
lose the
accident.
sheriff too, or just me?
I'm sorry, what, David?
No, I did too. I think he's gone right now.
Yes,
Can you
I
hear me?
agree.
Can you hear any of us?
Not in the room with you guys, Mr. Ford?
Can you hear me, Commissioner Engen? Nope.
I believe he was in the commission
I
room.
thought he was too.
Thought
Maybe
we
we
lost
lost-
Mr. Ford also.
Think so.
Can you hear me online?
Yeah, we're still there.
Great timing.
They're there, but they can't hear
They can't
us.
hear us or see us for some reason.
We have to all learn sign language.
All right, how's that?
Can you hear us now?
Tom is checking on it.
So he's the finance person and the IT guy and the administration guy today, huh?
Yeah,
Wow.
it's a big feat.
I have grave concerns right now.
Yeah, that's right.
All right, how
He's
can
only
you guys
one
hear me
step
out there?
above you and I in technology, so that's a problem.
Yeah, I know, that's scary, isn't it?
The only thing I can think of doing is closing and starting
Michael,
over.
do you know?
We hear you now.
He could restart the stream if he wanted to.
Yeah, just
Besides
restart
that, there's not anything you can do.
I mean, like end and re.
And the stream.
Oh, we hear you now.
Oh, okay.
We can hear you.
We hear you.
All right, good.
Can you hear me, Commissioner Engen?
Yeah.
Yes.
Perfect.
Good to go.
The sheriff will have to start all over.
We'll try this again. Good evening, Madam Chair, members of the commission. This is Sheriff Andy Schneider coming before you. As I did a few months ago, we had a patrol vehicle that was totaled out in a collision. We are currently in the process of trying to replace that vehicle. After some research and looking for a replacement patrol vehicle, we've discovered that our only option will be a 2021 fleet model. Recently, we sold an extra vehicle that we had, and I'm requesting that money be transferred from the general fund back over to our vehicle budget. The total revenue amount from that vehicle after taxes and transport, et cetera, is $4,888.25. I'm requesting the full money be transferred over to our vehicle budget so we can proceed with the purchase of the vehicle. And I'm open to any questions or comments you have regarding that.
Questions, anyone? Okay, I have a question. So the new vehicle, what's the cost of the new vehicle?
$36,940.
Okay, so with the Nedrow check, the proceeds from the 4 vehicles plus the proceeds from this vehicle, so
That will leave me about $1,000 short.
We're about to be about 35,555, so about 1,000 short.
Yep, and I can I have that in my budget.
Great.
Yes.
Great.
I will not be coming forward requesting for any other budget transfers.
Okay, so.
Madam Chair, I would make a motion that we allow that transfer of those funds to Sheriff Schneider's vehicle budget.
Okay, we have a motion. Do we have a second?
Second, that's
Oh, everyone's seconding it.
We have a motion and a second then, based on Sheriff Schneider's request. Any further discussions or comments? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried.
Thank you. I have nothing further.
Thank you. You stay safe. Okay, next order of business is Director of Administration.
Madam Chair, members of the commission, I was thinking I'd bring you our base retention advisor's contract extension today. I'm still awaiting the extension from Mr. Schlossberg. And then once I have it, I need to get that over to Ms. Wamstad to review. So my goal is to bring it on the 17th, the next commission meeting. I don't have it today.
Okay. All right. Anything else for us?
That is it, ma'am.
All right. State's Attorney.
Madam Chair, members of the commission, I do not have any updates today. Thank you.
Thank you very much. Committee reports. So we have Sheriff Ross. Whoops, sorry. Commissioner Ross.
Madam Chair, next 2 weeks from Monday, I have a Northeast Human Service Advisory Board meeting. Other than that, I have nothing.
All right, thank you. Commissioner Peach.
I have nothing to report, Madam Chair.
Thank you. Commissioner Paul.
Had a meeting with Mr. Ford and Mr. Sawyer. Good meeting, nothing that we can talk about right now, but he's still productive out there, so I'm feeling very positive. And working on a couple of matters with human resources, and other than that, nothing.
All right, thank you, sir. Mr. Engen.
Nothing to report this time.
Okay. And all I really have is we'll have the canvassing board on Monday, the 9th. So I'll be sitting in on that. Their board is on the 11th of November. And just a quick update on the library. They had COVID in the library, and so that currently is closed. And so the board will be meeting again to see how we proceed with that. So, but they're still providing their services, their good works and what have you. It's just physically no one in the building. So that's all I have.
Chairman,
Yes, sir.
just one other thing. I think I would like to, and I think all the commissioners would join me in congratulating you, I guess, or thanking you for all of the work that you've done, which is volunteer on the election, and it's really above the call, so we appreciate it.
Well, thank you very much.
I agree.
Thank you. And, you know, it was an absolute pleasure for me to be part of that. It's a real learning experience, and so it's good to see the process that staff have to go through in those situations. And so thank you very much. I appreciate that, but it was a real privilege for me, I think, to be able to be involved and help staff. So anything else? Unfinished business, I don't think we have anything else for unfinished business. Correspondence, there's nothing. Anyone want to make an adjournment?
I make a motion, we adjourn.
Thank you, sir. We have a motion to adjourn. Do I have a second? Do we have a second?
I'll second that motion.
Please. Okay, motion and a second. No further discussion. All in favor signify by saying aye.
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 Opposed, motion carried. Stay safe, everyone. And then Ms. Teach will wait to hear from you